The first presentation I will be speaking about burden of dengue. So what is the problem of dengue at a global level as well as at the national level in India? So what is the burden of dengue and what are the program targets? What are the key targets we have at the global level? And then some of the epidemiological factors that can contribute to dengue transmission. So these are some of the areas, broad areas I will try to cover in this presentation. So first we will talk about the global burden of dengue. At the global level, what is the burden of dengue? In 2010, scientists, they have tried to estimate the burden. They tried to measure the burden of dengue across the world, across countries. As you can see, what is the total million infections estimated? They have estimated what is the total number of infections. You can see the first box. So in the first box, what is the total burden of infection they have estimated? So they estimated 390 million infections. 390 million infections. And out of the 390, 294 million are they are asymptomatic infection, and 96 million were symptomatic. So what is coming out strongly in this second box? So 297 million infections estimated were asymptomatic and only 96 million were symptomatic. So what is strongly coming out from the second box? Which is higher? Asymptomatic or symptomatic? Which infection is very high in dengue?
Asymptomatic.
Yeah, asymptomatic. Like in COVID also, no? COVID also, we know that majority they are asymptomatic. If you take 100 people with COVID, I think 60-70% will be without any symptoms or mild symptoms. So in the same way in dengue also, majority 3/4 of the infections, as you can see in the second box, 3/4. If there are 4 people with a dengue infection, 3 will be without any symptoms. Majority are asymptomatic. They will not develop any symptoms. Only 1/4 they will have symptoms. So in among those who develop symptoms, only few are hospitalized. Still majority of 96 million, they have symptomatic infection, but still only 500,000 or 5 lakh only are hospitalized at the global level. So hospitalization is very less. Majority, even if they develop symptoms, it is only mild symptoms. Only some develop serious disease and they get hospitalized. Among the hospitalized also, the death is very less death, and the deaths are mostly among children. So this is a global burden of dengue study published in 2010. They have done in the year 2010. But after this, there was one more study on global burden of disease. They used the global burden of disease data in 2013, and it was published in 2017. You can see globally 4 billion people. I think now the global population is 7 billion. So 4 billion population are at risk of dengue infection. They live in areas where dengue is endemic. Among these 4 billion people, every year they estimated 58 million people, they develop apparent infection. Apparent is symptomatic. The apparent, symptomatic, all these are all very same. 58 million people, they develop apparent infection. Among them, they have estimated 9,000 deaths. 9,000 people are dying every year due to dengue at a global level. So this is not at India level, it is at a global level. And they have estimated something called DALI. 1.14 million DALIs were lost. So DALI is a measure that combines like mortality and morbidity. So death as well as people suffering is also measured, not only death, their suffering is also measured. That is the number of daily adjusted life years lost. That is DALI. It accounts for both life lost as well as the suffering. So 1.14 million DALIs were lost. So from this slide, the key message is around 58 million people, they develop symptomatic infection every year. Around 10,000 people are dying every year at global level. So this is a key message from here. And again, recently, there is another estimate published, again based on global burden of disease study. Here they give estimate of three measures. One is incidence rate, and the other one is daily rate, and the other one is the mortality. Mortality is death rate. So the first map is showing the incidence rate. So where you see very high incidence, where the incidence is high, can someone look at the first figure in the left top? Can you please see that map, a global map, world map, and see where the incidence is high?
Brazil.
Yeah, Brazil. Yeah, then
India.
Yeah, India.
Mexico.
Very good.
Mexico.
Yeah, Mexico. Yeah.
Indonesia.
Great. Yeah, Indonesia. Yeah. I think we can broadly thank you for highlighting this. Broadly, I think we can say that the incidence is high in Southeast Asia region. Southeast Asia region covers like India, Bangladesh, and then all this Indonesia, Singapore, all these countries, no, like Southeast Asia region. You can also the west side, if you see in American region, is it high in North America or South America?
South America.
Yeah, it is high in the South American countries like Brazil or Mexico, as you said. So these countries in the South America. So South American countries and some of the Asian countries, they are at higher risk of dengue. Also now the dengue is increasing in Africa also. You can see some countries in the Western Africa, they are also having higher incidence. So this is the global picture. And you can see that even in the Asian region, compared to Latin America, Asia, the incidence is high. Even in the Asia, you can see India is very bright. That means that the incidence is very high. It's highest in countries like India. So the second picture tells about the DALI. I think one of you asked the question, what is DALI? DALI is disability adjusted life year. Disability adjusted life year. That is DALI. DALI is it is a composite indicator of YLL plus YLD, years of life lost and years lived with disability. So because of dengue, there are people dying. So we take the data of death also, and then because of dengue, people are hospitalized. People are some may have severe illness. Because of severe illness, they have to be hospitalized, and after that they take a lot of time for recovery. So some amount of days were lost in disability. So they are not dying, but they are suffering. So this indicator combines both the years of life lost and years of life lived with disability. That is the DALI. DALI is disability adjusted life year. That is used for measuring the burden of disease. You can see that DALI, highest amount of DALI, even though the burden you can see in Western South America also, but the DALI lost is very high in which country? Which country the DALI is lost? More DALIs were lost. Second figure. Second figure where the DALI is high, that is the number of years of life lost or lived with people living with a disability due to dengue, is high in where the color is high in the second figure.
India.
Yeah, India and some of the Asian countries, no, you can see the DALI rate is very high. That is, more people are dying due to dengue, and more people are suffering. Their number of days spent with suffering due to dengue is high in some of the Asian countries, including India. Whereas in South America, you can see the dengue is there, but the suffering is not there much. Maybe the death is low, or maybe their suffering is less, even though they have disease. Maybe they are managing well. The DALI is high in. On the third figure, you see the mortality, death per 1 lakh population. So where the death per 1 lakh population is high, the third figure.
India.
Yeah, again India. So the death and some of the, like you have said, Indonesia and all those countries, like in the just countries above the Australia, no, like the island countries, there also the death is very high. Also the daily loss is high. So even though the, like you can see that dengue is more common in South American countries and it's more common in Asian countries. But the death is high compared to Latin America or South American countries. The death rate is high in Asia. So this is one of the observation from this study. Next, coming to burden of dengue in India. So there are, I could see like three studies estimated what is the burden of dengue in India. How many people are suffering in a year? So the first study is part of a global study. You can see that 33 million people are suffering from. 33 million means you can 1 million is equal to 10 lakh. Yeah, 10 million is 1 crore. So around 3 crore. It's around 3 crore, no? 3 crore people are suffering from dengue infection every year. Yeah, as you have seen in the previous slide also, India is a major contributor of dengue infection, global burden of dengue. 1/3 of the dengue infection is occurring in India. If there are 3 people with dengue in the world, one is from India. 1 out of 3 people suffering from dengue is from India. So this is the finding from the study, the first study. And the second is based on a sero survey. The study estimated the burden of dengue among individuals 5 years to 45 years. So they have estimated 13 million infection. They have estimated 13 million. Another study using, yeah, do you have any questions? Yeah, the third study is estimated dengue, symptomatic dengue cases using global burden of disease. In 2016, it was published. They have also estimated 53 million. So there are a variety of estimates, like different estimates are available for India, the burden of dengue. But one thing we can, the carry home message is, we are reporting very few number of cases in the VBDC. The number of infection occurring in the community is, there is a huge difference between the number of cases we report and the number of infection occurring in the community. Because the infection occurring in the community majority are asymptomatic or mild infection, and they will not be captured by the routine our surveillance system. Our surveillance system captures only like severe cases, hospitalized cases, those who come to the hospitals. So those who don't come mainly because of asymptomatic infection or mild infection, so that is not captured by our routine surveillance system. Dengue surveillance is in India, it's carried out by three programs. Like one is NVBDCP, National Vector-Borne Disease Control Program. And the other program is like Integrated Disease Control, Disease Surveillance Program. Sorry, there is a mistake here. IDSP, should be IDSP, Integrated Disease Surveillance Program. And the third one is Virus Research and Diagnostic Laboratory Network, shortly called as VRDL. So the VRDL network is maintained by Indian Council of Medical Research. So ICMR is doing the surveillance using VRDL, Virus Research and Diagnostic Laboratory Network. And the other two are like IDSP, Integrated Disease Surveillance Program, and the other one is National Vector-Borne Disease Control Program. So the three agencies were involved in the disease surveillance, dengue surveillance. So this is the dengue incidence data from India. So this graph doesn't include the most recent years because I could not find the older the case reported for previous years in the NVBDCP website. NVBDCP website, it provides data only for recent 4 or 5 years. You can see that the dengue incidence in India started rising from year 2000. After 2000, 2000 only it started rising, and you can see in 2013 it's peaked, and now also it's continuing. The dengue cases they continue to occur in India. So you can see this dengue is a it became a major problem only in the last 20 years. How long the Odisha is dengue is a problem? When you started having this problem of dengue in Odisha? Because I am from Tamil Nadu, I remember from 2008-9 only we have this huge problem of dengue in Tamil Nadu. Maybe is it after 2010 in Odisha the dengue is more, dengue cases are more?
Yes, sir. In 2012, as per my knowledge, sir, in my district, 2012.
2012. Thank you.
Yeah, yes, sir.
So I think after two initial outbreaks were reported in Delhi and surrounding Delhi, and subsequently it spread to other parts of India. And I remember in Tamil Nadu they started reporting large number of cases from 2009-10 onwards. I think same with Odisha also from 2012 or 13. It's after 2010 the cases are rising. You can see this is the IDSP map available in. Yeah, regarding the data after 2014, it is there in the website. It is there in the website, so I could not plot it because the problem is we can plot for 2014 to till date. We have the population, we have the numerator number of cases. But before 2014, this graph is only available in the I saw in the public domain. I could not get the number of cases. Number of cases reported before 2014, so that both the information can be clubbed and constructed as an updated graph. After 2014, the data is available. I think last 5 years data is available in NVBDCP website. You can refer state-wise number of cases are there. So IDSP 2008 to 2020, this map is available in IDSP website. You can see where the burden is high, where more number of outbreaks were reported. In India, is it uniform across India or is it more in some part of India?
In Maharashtra.
Yeah. Maharashtra.
Karnataka.
Karnataka.
Andhra. Tamil Nadu, Kerala.
Tamil Nadu, Kerala. Yeah, southern states, they reported more number of outbreaks, no, compared to. How about the situation in Odisha? I could see some districts highlighted in Odisha, no, Odisha. So what are those districts? Yes, the names are not there. You may be able to remember from your map. Which are those districts reporting more cases of dengue in Odisha?
One is Baleswar, sir.
Okay. I think I could see 1, 2, 3, 4, 5, some 6 districts, 6 or 7 districts. Some of them bordering with Andhra Pradesh or Andhra Pradesh or Telangana. That is Andhra Pradesh, I think. Some of them bordering with Andhra Pradesh. Yeah. Odisha, how many districts the dengue is a major problem, or is it across all districts, or some districts are?
Mostly, sir, coastal districts.
Mostly it
Good
is coastal
afternoon.
districts.
I am from state NVBTCP.
Yes, ma'am.
It is dengue is reported first in Odisha in 2006. Then from 2011 onwards, it is being reported in the state regularly. And every year we are getting cases. And this year, for last 2 years, it has almost become. This year, it has almost become perennial. Throughout the year, we are getting cases. And cases are reported from all 30 districts. Previously, we were getting cases, index cases from migrated from different states, adjoining states, neighboring states, probably mostly from Andhra Pradesh, Karnataka, and Delhi, Mumbai. But gradually that become local, and we are getting cases from all 30 districts. And in different years, different district become the epicenter. And as our Baleshwar VBDC said, Baleshwar was one of the high case reporting districts in 1 year, but it is a perennial problem in the state.
Thank you, ma'am. Thank you. I think that's because I don't know the situation in Orissa. I think you have summed up summarized nicely the situation of dengue problem in Odisha. Thank you so much. Next, I think we have seen some reports like NVBDCP website. You will find the data for dengue state-wise. I think for last 5 years, the number of cases and death data you can get. And IDSP is also having some reports on dengue. They also collect information on dengue outbreaks and they produce reports. And the other one is like the ICMR-led Virus Research and Diagnostic Laboratory Network. This network was established in 2014 and they analyzed 2014 to 17 data. They mostly like this viral research and diagnostic laboratory network. They are all situated in medical colleges and tertiary care hospitals. So suspected patients coming to these centers, they were tested for dengue. So what we could find like is like around in the 2014 to 17, around 2 lakh suspected patients were tested and they found the positivity rate was 28%. About 28% of the suspected patients were confirmed with the dengue. And through this network, they have diagnosed around 190 dengue outbreaks or dengue clusters. So this is the data from VRDL. So summing up, they have the VRDL network also like they have given the dengue positivity by age group. So what do you observe from this slide? Like by age group, you have the number of suspected patients tested and percentage positive. So what does it show by age group? Is the positivity varying by age group or is it similar or is it low in some age group? I think you can see that in more than 60 years age group, I think somebody with Sanjeet Kumar, can you please mute? Yeah. So the percentage positivity is like bit lower among the elderly population, more than 60 years age group compared to others, like 31 and 30% in the middle age group, about 10 to 40 years. Coming to the primary and secondary, so the VRDL network also they have classified. There was a report they have classified 1372 dengue cases, 1372 dengue cases, and they have classified them as 65% of these dengue cases reported to the network as primary, and 35% of them were secondary in nature. And by looking at by geography, they found that the secondary infection is very high in the southern region. More than 65% of the dengue infections were secondary in nature in southern region. Whereas in states like Jammu and Kashmir, it's only 10%. So there are variations in percentage of the dengue infection secondary. So why this information is, do you think this information is not routinely collected in our surveillance or NVBDCP? So why do you think this the percentage secondary infection is very important? Any thoughts on this? Why we should know what is the percentage of secondary infection? What is the percentage of primary? Why this information is important? Yeah, because we know that secondary infections are severe in nature. They are severe and they are likely to be hospitalized. So knowing the percentage of secondary infection will be helpful in planning our health services, like how many beds we need and how much of manpower we should dedicate for dengue treatment. So this kind of planning of health services can be done if you know the percentage of secondary infections. because that is linked with the severity. Secondary infections are more likely to be severe. And then there is a systematic review published on dengue burden in India. So this study summarized all the publicly available data, and they have summarized as one report. This systematic review found that 38% of the suspected patients tested in all the laboratories or hospitals, the positivity rate was 38%. Among the clinically suspected patients, 38% were laboratory confirmed as dengue infection. And they have also summarized the seroprevalence of dengue in general population. Seroprevalence is like testing for IgG antibodies, like how we do the serosurveys for COVID to know what is the percentage of the population exposed to SARS-CoV-2 or COVID. The same way, there were several studies which did serosurveys, and based on the serosurveys, it was found that pulling information from all the serosurveys, the study like summarized meta-analysis, meta-estimate, they produced meta-estimate, which is 56.9, that is around 57% of the population in India, general population, they were exposed to dengue. So 57% of the population, they already have some antibody for dengue. And then based on the studies, primary studies, the systematic review also estimated the case fatality ratio of 2.6%. 2.6% is a little very high among laboratory confirmed dengue patients. It tells about out of the total cases, like 100 cases, 2.6 are likely to die among the laboratory confirmed dengue patient. That is the case fatality ratio. So out of the total cases, how many are dying? So that case fatality rate in India, it was estimated as 2.6%. So this systematic review of dengue burden in India, they also recommended some, they found there are some gaps in evidence, and they recommended the need for cohort studies and need for a nationwide seroprevalence studies. There was one cohort study done. Do you know what is cohort study? I think earlier lectures they might have covered. Can someone tell what is a cohort study? I think a cohort study is a group of individuals. We are following these individuals to estimate the. Yeah, thank you, sir, for this question. I think you have asked case fatality rate ratio by serotype. This is for overall, irrespective of serotype, but I have to check the full paper. I think I have given the link below. For all the slides, I have given the link for those studies. You can just click that link. You will go to that particular research paper, and you can find out. I don't remember reading in this paper CFR by serotype, but definitely I think I can check back and check this and check for this information and get back to you. So this cohort study in India was, there were no cohort studies. There is only one cohort study published by CMC Vellore in Tamil Nadu. So the cohort study was conducted among children, and they have followed around 6,648 children, and they have tested 2,300 children for dengue. While during the follow-up, they picked 868 febrile episodes, and in that 82 febrile episodes were found positive, and 81 children had positive infection. So they estimated an annual incidence of 4.95. So in this study estimated out of 100 person years, for every 100 person years follow-up, 4.95 is the incidence of dengue. And if you compare this incidence with other studies, like there were 2 vaccine trials conducted in Asia and Latin America. There were like 2 trials. One is the Sanofi's TDV, CYD TDV vaccine, that is called a dengue vaccine. So this dengue vaccine, when they conducted the trial in Asia and Latin America, In the Asian cohort of children, so in the unvaccinated arm, because in the vaccinated arm, we will expect the incidence is low. In the unvaccinated arm, the estimate was similar. The incidence was 4.6 per 100 years follow-up. The second study is the TDV vaccine. So it is going for the approval stage, the second vaccine developed by Takeda pharmaceutical company. The first one is Sanofi's dengue vaccine, and the second one is the TDV's Takeda vaccine. The Takeda vaccine in the unvaccinated arm, they reported an incidence of 2.5 per 100 years. So you can see that it's somewhat like comparable, the incidence in India. So this is about the burden of dengue infection in the world at the global level and in India. So next part of my topic is on the epidemiological determinants of dengue. What are the epidemiological determinants of dengue? We know that the most important risk factor or determinant is the geographical. So where you live determines whether you are at risk of dengue or not. So geography is an important risk factor where you are living. As you have seen in the global map, like people living in Southeast Asia region and people living in Latin America, they are at higher risk. So that is an important determinant of dengue. And then coming to the overall period distribution, we will discuss about how the distribution of dengue in terms of temporal, like by time. We will discuss about the periodicity and seasonality, and then the role of population density. So again, this is from a study from India, which looked at the average incidence rate of dengue among the reported cases. This is again among the reported cases from 1998 to 2014. So in India, it's very similar to like IDSP reports. Like you see that states in South India, like Karnataka, Kerala, Tamil Nadu, some parts of Maharashtra, still based on the reported cases, it's low. Gujarat and Odisha. So we are all having the southern part of India, the incidence is high. So this is the geographical, like the endemicity of dengue is high in southern region. And then cyclic epidemic pattern. I did not have any report from India, but there was one good study which summarized the dengue in Singapore in 2004, from 2004 to 2016. So one of the important feature of dengue epidemics, they occur in cyclical pattern. There will be some years the case will be high, and after that the cases will be low, and after a few years then again the cases will start rising. Typically in some countries it occurs once in 3 years. So there will be a rise in case in 1 year. After that, in next subsequent years, the cases will be low. After 3 years, you will see again a rise. So it occurs in a cyclical pattern. So the reason for the cyclical pattern. So do you see any cyclical pattern in Odisha? Like some years it is very high and some years it is very low. Do you see this kind of pattern in Odisha?
Yes, we see it.
Yeah. Is it some years the cases are high and some years it is very low, or is it same all the years? Every year you get the same number of cases, or some years you see very low number?
Some year we see very low number, and we attribute to last year we got very low number of cases, and the reason could be the COVID scenario of the state. And as we have sentinel site laboratories for diagnosis of dengue in all the districts, and even more than we have 30 districts, but we have 38 sentinel site laboratories, and we get more number of tests done for dengue, and we get more number of cases. So this year we are getting highest number of cases. So there are fluctuations in different years.
Yeah, thank you. Yeah, as you can see, like it is a cyclical. The dengue classically appears as a cyclical, follows a cyclical pattern. Some years it will be very high and some years it will be low. Like I think even in Tamil Nadu here also, the this year cases are high compared to the previous 2 years. I think in 2017 it was very high, and 2018, 19, even 20 was low, and in now 2021 it is very high. High incidence of dengue cases reported this year. So the cases follows a cyclical pattern. So what is the cyclical pattern? So the cyclical pattern they have recorded in Singapore. Like they observed 2 cycles in their country. So one is from 2004 to 6, and the other cycle is from 2013 to 16. One of the reasons, like there are 2 reasons why they say this dengue appears as a cyclical pattern is mainly because of changes in the serotypes. Usually some serotype will be dominant, and then suddenly some other serotype in the area is introduced, then you see a rise in cases. So after that, it comes down, and it becomes that becomes like a dominant serotype. And after 2 or 3 years, again some other serotype comes. So this switch in serotypes, that is attributed as one of the reason for having this cyclical pattern. And the other reason attributed for the cyclical pattern is changes in the population structure, like because we know that new children are born, they are all susceptible. So once this susceptible pools get accumulated, then you will get an outbreak, something like that, like something like we see in measles also, same pattern. So accumulation of susceptible individuals and switches in serotypes. So these are attributed as reason for having the cyclical pattern. And coming to the seasonality, this VRDL network, they have mapped the seasonality. I think you all know that this follows the rainfall pattern, and you can see that the cases start rising in the month of, even though now we say that because dengue becomes endemic, the cases are reported throughout the year. Still, it follows the seasonality. There is a strong seasonality with dengue. In the June, July, we start like increase in the cases. The cases are rising, and now it peaks in the month of October, November, and after that it start declining. I think Tamil Nadu and Orissa, these states we get monsoon from the northeast monsoon. So immediately after the northeast monsoon, the cases start rising. Whereas states like you see in Kerala or Maharashtra, they will be receiving most of the rainfall from southwest monsoon. So their pattern will be slightly different. They may be getting outbreaks earlier than us. Another important feature is like with the population density plays a major role. Like in Vietnam, they have done a study, and they found that the number of dengue cases per 1,000 person years, the incidence is very high in those areas where more people, like 100 and it's around 190 people, I think 190 people per 100-meter radius. In 100-meter radius, if there are 190 people, then the incidence is very high. But after that, it doesn't make a difference. So that is considered as a critical population density for having a high risk of dengue. So coming to the program targets, I could not see any national in the NVBDCP website. I tried to search for having program targets, and I think you will be very familiar. I don't know whether there are any program targets available for dengue, but at global level recently there was a dengue is considered as one of the neglected tropical diseases. So WHO, they have put a number of diseases into NTD, that is called neglected tropical diseases. In the neglected tropical diseases, dengue is one of the neglected tropical diseases. So in the neglected tropical diseases, they have prepared a WHO prepared a roadmap from 2021 to 2030. So for dengue is selected for control because we know that it cannot be eliminated now. It cannot be eradicated now. We don't have the tools. So we don't have the vaccine on the ground, and the vector control is very, very difficult. So we know it cannot be eliminated or eradicated now. So they have chosen dengue for control. And in the control, the first target they have kept is the case fatality rate. So they want the case fatality rate, the current baseline at global level, they have taken as 0.8, and they want to reduce it to 0%. That is zero death of dengue by 2030. So this is the target at global level adapted for dengue program. So if there are any targets for NBPTCP or national programs, you can share with me because I'm not aware of